And I think it's great that, you know, nurses and providers and the different people are opening the conversation with patients about hospice, because it's such a great program, right? And we should be comfortable having these conversations. And so the next one, right? If a patient just wants it, that's not a reason for someone to be admitted to hospice. Medicare has requirements depending on what their diagnosis is that they need to specifically meet to demonstrate that they are going to pass away in 6 months or less, right? Of course, we know people go on to hospice and sometimes they live longer just with the extra quality care, and stopping some unnecessary meds sometimes gives people a little bit longer to live, which is great, right? Lonely, I've done another video on that. Lonely is not a reason for someone to be admitted to hospice. Again, you know, especially if they live in a facility, you know, facilities have to have activities. Maybe it's not something they enjoy, whatever. Maybe different programs might have volunteers that can come in, but lonely and emotional, it's really not a reason solely to refer someone to hospice. I just brought these up because it's kind of, I've had some scenarios where I've heard some staff members or even residents talking about hospice services and asking about them, and, you know, just again reinforcing that there needs to be documented decline, whether that's physical weight, their condition. They have to have a diagnosis to admit on service. So, you know, it is not just a service that anybody is just eligible for just because. You have to meet requirements. But anyways, I'm rambling, but that's what I wanted to share today.